Thank you. So today I'm going to present two studies that we have been doing at ACTA, and they are related to identifying protein signatures in oral rinse samples. One study is going to be about periodontitis and the second about diabetes. But before telling you more about what are those proteins coming out for each disease, I want to share a little bit about periodontitis and diabetes and their prevalence. Most of you know that almost half or more than half of the population has periodontitis, and a lot of them, they don't know it because there are even no symptoms or mild symptoms, and 24% of them, there are severe cases. And diabetes is also a very big problem because we have 11% prevalence worldwide, and actually more than 40% of them are undiagnosed. So what does that mean? That, okay, a lot of people in later stage of the disease, they go to the medical facilities, they go to the periodontal practice, and they are getting diagnosed. But what about before? What about earlier stages of disease? We need screening for that. So, and that's why, it's also the project that I'm going to share with you, it's related to that. So far, what's happening? People for periodontitis, they go for oral examination, or people to diagnose for diabetes, they go for the blood test. But this is mainly for diagnostics. But then for screening, there is a saliva option, so collecting saliva. But this is an easy way, of course, but still people with hyposalivation might have issues. And that's why oral rinse sample, what we are also examining, it's an easier solution, it's simple. And what is an oral rinse sample now? So the participant or the patient will be provided with a phosphate buffered saline solution, which is a solution of pH 7, a neutral solution. They rinse that 30 seconds in their mouth, and then this is what they provide back, and this is what we also use for the lab analysis. So then the question comes, if we can use those oral rinses for screening for disease. In our case, we check for periodontitis and diabetes, but then in the future, and it's also part of my PhD, to check for cardiovascular disease, and this can be extended to any disease, actually. And since proteins are reflecting the disease activity, this is also why we do the proteomic analysis of the oral rinse samples. And this is also what is the research question of those two studies, whether the proteomic signatures of oral rinse samples can be used to screen for periodontitis and diabetes. So first study, we collected data at ACTA, 54 participants, 38 with periodontitis, 16 without periodontitis, and we did at Olink, it's in another company which is specialized on proximity extension AC technology for targeted proteins. So they did the inflammatory immuno-oncology panel. And second study for diabetes, 176 participants, 20 with diabetes, 156 without diabetes. And here we did 92 targeted proteins. The methodology that we have developed is the same, for both techniques, so it's disease agnostic. And as I said, we collect the oral rinse samples, then we do proteomic analysis. We have the disease labels, and we put everything in the machine learning model. This is actually where my expertise comes from, where I put most of my work. And then the outcome of this model is the proteomic signature. So what are the top proteins for distinguishing disease from no disease? Then the model performance, which is something very important, because if low performance is not good enough, then this proteomic signature is not reliable enough. And then the model interpretation, because we want to see, okay, we get 10 proteins, but then we want to see which one is the most important. So we want to see the rank of it. And then a little bit more about the machine learning. Since my background is in data science, this is also the area that I put the most work on. And I have experimented with 3 different algorithms. logistic regression, random forest, and XGBoost. And logistic regression, I used it because it's a model which is used widely on traditional statistics, and I use it as a reference. So to see, okay, starting from logistic regression, which is a linear model, if I can have non-linear models, which are random forest and XGBoost, and whether the non-linear models perform better than the linear. So this was the three algorithms that I used, and then I wrapped them, let's say, around the repeated nested cross-validation technique, which is a technique that can be quite useful when you have not a lot of amount of participants, which happens very often in these medical studies, and you have a big number of features, proteins, omics data, it can be whatever. So then this repeated cross-validation, you do multiple iterations, and then you get an unbiased performance on how well your algorithm performs in different splits of your data. So you do a split of the data, train in in part of the data, you validate in the rest, and then you do again. And then, because there is the problem that we have many proteins, and we want to say, okay, what are the most important proteins to pick some of them. That is where I use the protein selection algorithm, which is based on the algorithm named Boruta. It's a random forest-based algorithm. Okay, and then after those iterations, I use the consensus model approach, which is the step of the algorithm that picks the best algorithm. And also it checks back all those iterations and selects the most frequently selected proteins, and at the end, the model interpretation. Okay, done with the technical part. This is the results. So this is actually the protein signature for periodontitis, the one that was identified from the machine learning methodology. And here you can see the top 4 proteins. But okay, what this graph now means? We see two sides. On the right side, it's the prediction which contributes to periodontitis. On the left side is the no periodontitis prediction. And we see on the right side having all these pink points, and on the left side the blue. But then what this means? Let's take galectin-1. For galectin-1, it means that a pink value, which means a high value of that protein, contributes more towards a periodontitis prediction, while a low value contributes more towards a no periodontitis prediction. And here you can see the proteins ranked based on the importance. GAL1 is the most important, and the rest are less important. So the same, another thing which is very important to check, it's also to have a good ROC-IUC. We want to have good performance metrics, because otherwise the protein signature that we have is not reliable enough. So the same I did for diabetes, and for diabetes we have a stop protein REG1 alpha. A high protein of REG1, a high value of the protein REG1 alpha means that there is higher likelihood for that person to have diabetes. And here we can see also the metrics, which means that good enough metrics give us a more reliable protein signature. Okay, then, so let's go back to the research questions. First research question was whether we can use oral rinse samples to screen for disease. We did those 2 pilot studies, and the answer is yes, it's possible. Also, we got very good signals, protein signals from the oral rinse samples. So these studies tell us, okay, you can continue with bigger studies, more participants, more proteins, which is something that we are planning to do. And also, we were able to identify 2 putative protein signatures, one for periodontitis, the other for diabetes. At the end, after identifying these protein signatures, we also did a post-hoc confounder analysis, because we wanted to make sure, after accounting for potential confounders like age, sex, smoking, etc., whether those proteins were still significant for that disease. And that was the case. So still those proteins were significant for the disease. Thank you for listening, and I would like to thank my collaborators and the contributors also to that research. Thank you. And later I will listen to your questions.